For many people living with chronic pain, the daily challenges are not only physical but emotional.
Recent research shows that many children who are hospitalised suffer unnecessarily.
It's been really tough. There's nothing worse than watching your child in pain. It's heartbreaking.
Pain is really common for people in hospital. We rely on patients to tell us how severe it is. And the way that we measure it is using pain scales. But the problem is they don't always work, particularly for kids who are either too young or too sick to communicate their experiences. My name's Crellin, and I'm a nurse practitioner at the Royal Children's Hospital in the Emergency Department and a senior lecturer at the University of Melbourne in the Department of Nursing. There's a lot of evidence that unrelieved pain results in short and long-term negative consequences for children. It can lead to things like poor healing, impaired cognitive development, and even fear of healthcare. I've seen kids who've experienced repeated painful procedures become completely terrified of coming to hospital, and that can be lifelong. So if we know pain is harmful, then it's crucial we treat it. But to treat it, we have to be able to recognise or assess it, and that's part of the challenge. I've been a nurse for over 30 years. There are so many options in nursing, different roles and specialties. I've worked in emergency most of my career, and that's allowed me to teach emergency skills in Vietnam and India. Now I work as a nurse practitioner, and my aims as a nurse practitioner are to provide really good clinical care. I do it by working clinically, but I also do it by teaching and undertaking research. One study probably in particular changed the course of my career. What became really obvious during this clinical trial were the limitations of the available pain scales. Emotions have a really significant impact on how we all experience pain. My research showed us that we don't have ways of differentiating between the two in little children. So we really have to consider them together and not separately. And that's what we're doing in this study. We're planning interventions that treat pain and distress, and then using a scale that will measure both. If I can drive enthusiasm amongst nurses for clinical practice and teach them something along the way, that's great. And if I can contribute something to the evidence, meaning that kids' outcomes are a little better in the future, then that's an absolute bonus. I want to pass on what I know, teach other nurses best practice to ensure that patients are cared for, to the best of our ability. It's so important to learn, to teach, how to problem solve and to collaborate.